On a hot summer night in 1893, a 24-year-old man named James Cornish was rushed into a small, understaffed hospital on Chicago's South Side. He'd been stabbed directly through the chest in a street fight. Every doctor he'd passed on the way told the ambulance drivers the same thing. Take him somewhere else. A black hospital? With a black surgeon? He'd never survive. But James Cornish wasn't looking for a hospital that believed in him. He was already dying. What happened next would change medicine forever. According to medical historians documented by the American Medical Association, the surgery that followed was performed without x-rays, without blood transfusions, without antibiotics, without any of the modern tools we consider essential to survival. The surgeon, a black man named Hale Williams, had to work by instinct, by experience, and by skill that most of his peers refused to acknowledge he possessed. He opened Cornish's chest. He found a tear in the pericardium, the sac surrounding the heart, and he stitched it closed. James Cornish lived. Cornish was discharged 51 days later. That surgery, recorded on July 10, 1893, is what most medical schools teach as one of the first successful open-heart surgeries in human history. But here's what they don't teach. It took a black doctor creating his own hospital to prove it was possible. Before Provident Hospital existed, black doctors in America were locked out. According to documentation from the National Medical Association founding records, black physicians couldn't work at white hospitals. They had no access to surgical training. Black patients were turned away from emergency rooms. A black woman named Emma Reynolds had been denied admission to every nursing school in Chicago, not because she couldn't do the work, but because of her race. So Hale Williams did something radical. On May 4, 1891, he opened Provident Hospital and Training School for Nurses. It was the nation's first interracial hospital, the first medical facility where black doctors could operate, where black nurses could train, where black and white physicians worked side by side, and where patients of all races received care without exception. According to the African American Registry, Provident became the first black-controlled hospital in America, and it graduated 118 women nurses from 24 states through its program. This wasn't charity. This was revolution. Williams had already taught anatomy at Northwestern. He'd been appointed to Illinois's State Board of Health. He was a respected surgeon treating both black and white patients in his private practice. But the system still wouldn't accommodate him. So he built around it. And he wasn't alone. According to National Medical Association historical records, in 1895, just 2 years after that heart surgery, Williams co-founded the National Medical Association because the American Medical Association explicitly refused black membership. He moved to Washington, D.C. as chief surgeon of Freedmen's Hospital, where he radically reformed a neglected facility that was losing patients. He returned to Provident in 1898 and continued pioneering surgeries that shouldn't have been possible. Here's what gets buried. Provident Hospital is still operating today. According to Cook County Hospital records, it relocated and is now known as Provident Hospital of Cook County. Over 130 years later, it continues serving the community Williams fought so hard to protect. The facility that started as a rebellion against segregation never stopped being exactly that. But the real story isn't just about one surgery. It's about what happens when a system tells you you're not qualified, not worthy, not good enough, and you build the proof anyway. When racism locks you out of the operating room, you construct your own operating room. When you're excluded from training, you establish your own training program. When institutions refuse to recognize your skill, you demonstrate it so undeniably that history has to record it. James Cornish survived. Generations of black doctors trained at Provident. Thousands of black women became nurses when the profession told them no. And a hospital founded as an act of defiance against segregation became a standard-bearer in American medicine. Hale Williams didn't wait for permission. He didn't petition for acceptance into a broken system. He built something better, And he invited everyone to witness what was possible when you refused to accept the limitations others placed on you. That's the kind of legacy worth studying. That's the kind of defiance worth sharing. What would you have done in his position? Would you have worked within a system designed to exclude you? Or would you have done what Williams did, built something entirely new? Drop your thoughts below. This isn't just history, it's a conversation about what we're capable of when we stop asking systems for permission.